Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper jaw for implant placement. Starting with the upper right molar region, as you can see on the transaxial view, we've got an approximate ridge width of 11 millimeters and a height of 11 millimeters as well. Then moving to the first molar region, we've got again D3 quality bone, 8 millimeters of width with 7 millimeters of height. In the region of the second premolar, we've got very limited bone. Sorry, this is the first molar region. My apologies. Um, this is the second premolar region. We've got 9 millimeters of ridge width with 3 millimeters of height. Then we move to the first premolar region. You've got a class 5 lesion, quite significant. If it is removed, you've got D2 quality bone, very good quality bone, and 18 millimeters of height. This is the canine. The canine has a periapical radiolucency, very deep root if it is extracted. We've got cortical plate perforation, 10 millimeters of width with 19 millimeters of height. Moving to the lateral incisor on the upper right hand side, again, this is also a grossly carious tooth, 7 millimeters of ridge width with 16 millimeters of height. In the central incisor on the upper right hand side, you've got an extreme BTR with a periapical radiolucency, 7 millimeters of width with 17 millimeters of height. In the region of the upper left central incisor, quite a significant periapical infection or radiolucency with buccal plate perforation, 8 millimeters of width with 16 millimeters of height. When we move towards the canine on the the lateral incisor, we've got a class 2 lesion, relatively good bone support, 8 millimeters of width with 16 millimeters of height. And then moving to the canine here, we've got a endodontically treated BTR, not a significant periapical radiolucency, but very poor obturation is done. This tooth approximately has a ridge width of 11 millimeters and a height of 20 millimeters, D3 quality bone. This is the premolar, again D3 quality bone, periapical radiolucency, 9 millimeters of width with 20 millimeters of height. This is the second premolar region, again periapical radiolucency, grossly carious BTR, buccal plate perforation, D3 quality bone, 11 millimeters of width with 14 millimeters of height. This is the molar region, the first molar region. This is the width. We've got D3 quality bone, 10 millimeters of width with just 7 millimeters of height. And then in the second molar region, we've got again relatively D4 quality bone, 9 millimeters of width with 9 millimeters of height. Now, the doctors also asked us how the other overall health is. The lower left 6 has a periapical radiolucency, which is quite significant. As you can see right here, we've got a radix entomoralis in this tooth as well, and we've got a, so all three roots are quite severely infected. We would advise clinical correlation, but this is a failing endodontic tooth with extreme periapical infection. This is the implant on the lower left side. This is an unrestored implant. We've got approximately 3 millimeters of substance outside. We don't know if this is a healing abutment or if this is a implant itself. When we move towards the implants which are placed, the lower right central region, we've got an implant here place shows slight bit of bone radiolucency around it, but we can't characterize that as per the implantitis. This is the implant in the middle of the prosthesis, doing very well, center of the ridge. And then this is the implant on the bottom right region, again shows signs of slight bone radiolucency around it. Thank you very much.